My name is Chandrea Bell. I am a wife. I am a mother of two. I have a little boy that is 1, and I also have a daughter. She's 7 years old.
So I first met Miss Bell about 4 months after she gave birth to her second child. And she was short of breath and she was struggling with her breathing, going upstairs or those types of things. So she ended up going to the hospital to seek help. It was getting bad enough to seek that kind of care.
Once going to the hospital, they called me to the back. They did let me know, hey, we're going to run some tests. And it was that word that I will never forget, well, those 2 words, and that's heart disease.
We gave Miss Bell the traditional medicines that we use for somebody that has a weakened heart or a cardiomyopathy, and she was doing well with that. Her symptoms were improving, but as we were seeing her in clinic, she expressed to us that she was struggling, given her age, given the sort of the weight of this diagnosis that we had given her.
My friends would say, oh, take your medicine, it's going to get better, and you're going to be okay, and you have the fight in you. And what they didn't know is that some days I just didn't have that fight. And I looked at them and they were healthy and they were doing good. And here I am, I just gave life, and now I'm fighting for mine. And I completely broke down because I didn't know how to manage. I had stopped taking my medicine. So all of the work, I felt like everything I had put into it, I no longer wanted to do anymore. And I expressed that to Dr. Skains. And I said, I need help. Because if I don't get help, I'm not going to survive.
That was when we were able to reach out, especially to Jackie Brennan, our clinical social worker, and she was able to work her magic.
So when I first met Chandrea, through our conversations, one of the things that really struck me was she shared that she was one of the younger ones with this new diagnosis of heart failure. And it occurred to me that she was one of many. And so I shared that with her, which was quite enlightening to her, that she was not alone, in this journey. And so there were other members of my team that she would benefit from their services. So I referred her to our health coach, to our exercise and wellness coach. So this team-based care model really provided her with a kind of comprehensive care plan to help her be more successful with this new diagnosis of heart failure.
It's important for us at HeartCare to continue to break down these barriers between us and our patients, sometimes that are there unintentionally, and to provide a comfortable atmosphere for our patients to be able to express that they're in need.
Advice I would give other women is that there is hope. To know that it's okay to reach out for help, and there are great resources that are out there that can help you. Because I remember how terrifying it was. I remember how scary it was. But to live in the moment of knowing that I'm winning, that I'm winning and I'm doing it, and I can make it, it's the best feeling ever. And so my advice is that you keep pushing, that you're not alone, that there are others that are going through the same thing that you're going through, and that one day your story can make a difference.